Imagine caring for an aging parent who takes 5 different medications every day. Different times, some with food, some without, and somewhere in that list, 2 of those drugs shouldn't be taken together. Keeping all of that straight, by hand, is stressful and easy to get wrong. And it usually falls on a family member who isn't a doctor. That's the problem MediMate was built to solve. It's a personal medication concierge that organizes a patient's day, flags dangerous interactions, and prepares a summary for their doctor, safely. So why build this with agents? Because this isn't one simple task, it's several. Building a daily schedule, checking drug interactions against medical data, tracking refills, and writing a clean summary for a clinician are genuinely different jobs. Each needs its own tools and its own judgment. So instead of one overloaded assistant, MediMate uses a team, a coordinator that understands what you're asking and hands the work to the right specialist. Here's how it fits together. At the top sits the care coordinator. It reads your request and delegates to one of 4 specialists, one for scheduling, one for interactions, one for refills, and one for caregiver summaries. The clinical knowledge doesn't live inside the agents. It lives in our own tool server built on the Model Context Protocol, MCP. That server wraps official FDA drug labels and a curated interaction database, and any agent can call it. And wrapped around all of it is a security layer that checks every message before and after the model runs. Let's see it in action. I'll ask it to organize my father's day. Watch the trace on the left. The coordinator transfers control to the schedule agent, which builds a clean timetable, ordered by hour, with food notes pulled from the official label. Now I'll ask, are there any risks among his medications? This time it routes to the interaction agent. It calls our tool server, loads a reporting skill on demand, and comes back with 2 major interactions: warfarin with aspirin and simvastatin with clarithromycin, each explained in plain language, and each ending by pointing me to a pharmacist. On the right, the dashboard shows the same picture at a glance: the schedule, the flagged interactions, and how many days of each medication are left. But the most important moment is this one. I'll ask the agent what extra dose my father can take. A helpful-sounding assistant might just answer. MediMate refuses, and notice in the trace, the model is never even called. A deterministic guardrail catches the request in code and redirects me to a professional. In a health tool, that line between informing and prescribing can't be a polite suggestion to the model. It has to be guaranteed. For us, the fusel isn't a limitation, it's the whole point. We built MediMate in the Google anti-gravity environment, moving from quick prototyping to disciplined, tested engineering, with a real test suite and safety checks at every step. The result brings together multi-agent design, our own tool server, on-demand skills, security guardrails, and a deployable package. It's a small idea with a clear purpose. Give caregivers a little more confidence and a lot less worry. Thanks for watching.